record.
Okay. Up here is the epicranial aponeurosis in white. Here we have the frontalis, also known as the frontal belly of the occipital frontalis. Here we have the orbicularis oculi, orbicularis because it orbits the eye, which is oculi. Here we have the levator labii superioris. Levator because it's going to elevate. Labii because the muscle will attach to the lips, and labii means lips, labia, lips. And superioris is because it's above the mouth. So levator labii superioris. Here we have the orbicularis oris. Again, orbicularis means to go around, oris meaning mouth. This small muscle right here is going to be known as the nasalis, which should hopefully be pretty obvious. Here we have number 25 is the depressor labii inferioris. Depressor because it moves the lip down, labii because it means lips, and inferioris is because it's inferior to the mouth. Here, that goes to the angle of the mouth, and that's what this is called, the angle of the mouth. This is the depressor because it's going to make it go down. It's going to make the angle go down. Depressor anguli, because again it goes to the angle, oris. So depressor anguli oris. This muscle right here is called the mentalis. You may remember the mental foramen. That'll help you remember that. On the lateral side, we have the masseter. This is the masseter. This muscle right here is termed the risorius. This muscle right here is termed the buccinator. It's tucked in the back. It's termed the buccinator. Here's the zygomatic bone. This muscle right here that comes off the zygomatic bone is termed the zygomaticus. Now for this, there's different professors have different interpretations of this. Some professors call it the auricularis, and some professors call it the temporoparietalis. The temporoparietalis, as well as auricularis, is going to be attached to this epicranial aponeurosis. If we go to the opposite side, we'll notice that this muscle, which is the temporalis, is attached to bone. So temporalis is attached to bone. If we look along the back of the neck, we have this right here, which is known, and it's going to go down a little lower, is going to be the trapezius muscle. So again, this is the trapezius muscle. Here we have the semispinalis capitis. Here we have the splenius capitis. So splenius capitis, the fibers go a bit superior and lateral, and the ones that go directly superior are known as the semispinalis capitis. Semispinalis capitis, splenius capitis, and this one right here is called levator scapulae. Levator scapulae because it attaches to the scapula and is going to elevate it. Above the spine of the scapula, we have the supraspinatus. Below the spine of the scapula, we have the infraspinatus. So spine of scapula, supraspinatus, infraspinatus. This right here is teres major, and my suggestion is goes teres major, teres minor, infraspinatus, spine of the scapula, supraspinatus. Because if your professor puts it here, some students will inadvertently say one of the teres, either teres major or teres minor. But if you work from teres major, teres minor, and the rest of this is infraspinatus, you won't get it wrong. This right here is going to be rhomboid minor, the small one, and the larger one is called rhomboid major. These with the fibers going up and down is called the erector spinae, and this back here is called the serratus posterior inferior.